Hello! I've been wanting to film an update about my knee issues. It's been a while since the last knee video, so I'll link that above if you haven't watched that. If you have no idea what I'm talking about, you might want to watch that one before you continue watching this one. I feel like I'm making this video more for myself than for other people, but I'll still put it on YouTube. It has been 43 days since I have driven a car, and I'm going absolutely crazy. It's been almost 2 months now since I had to stop driving because I hurt my right knee really bad, and I went to the doctor and now I'm having surgery on New Year's Eve. So it's still about a week away, a week and 1 day until my surgery. At the time that I posted that last video, I was wearing a new knee brace that had a hinge in it. And at that time, I was excited about it. I was excited to be able to bend my knee after like 2.5 weeks of being in the brace that I had gotten from Patient First that kept my leg completely straight, and I was on crutches. It turned out to be terrible. It didn't make any sense to me to be wearing that brace before the surgery. I hadn't started physical therapy yet at that point, but the doctor or someone had said that I was going to be bending my knee more and using it more, and that was going to get the swelling that had been there for over 2 weeks to finally go away. But it wasn't going away wearing that brace, and it was getting worse. That brace was just making my life so much worse. I could not use the restroom when I'm wearing that brace. It goes all the way up to my crotch and down to my ankle. Because I was wearing that brace and trying to make it work, I was using the crutches even longer than I probably should have been, and I lost all of the strength in my leg, and that was just crazy. So I made the executive decision, after going back and forth with the doctor's office trying to explain how this cannot be helping, like, can you please just tell me that I don't have to wear this until after the surgery? Because I understand having to wear that crazy thing after the surgery, but not beforehand, especially if they're telling me that they want me to be in good condition before the surgery. This thing was just making me weaker and weaker every day. So I made the executive decision to stop wearing the brace, and I can actually walk pretty normal at this point. I've been going to physical therapy twice a week. I guess like the main purpose of it is to just make sure that all of the muscles that are gonna be really playing a big part in my recovery are as strong as they possibly can be before the surgery, to make the recovery a lot faster and easier, I guess. I don't love physical therapy. I had bad experiences with physical therapy for my knees when I was younger, so I was going into it with a lot of anxiety just to begin with, but it wasn't as bad. It's as I expected it to be from the start. I guess the worst part about physical therapy is just that it's inconvenient to go to. I work like a normal day job Monday through Friday, and then I have a night job as well, so I have to leave work to be able to make it to physical therapy. I leave my day job for like 2 hours to go because you have to travel there, and it's not super conveniently located to my house, and there's been a lot of traffic, and there's 100 stoplights in between here and there. The parking is never great. It's just like an annoying thing. But luckily my dad's been able to drive me to all of my physical therapy appointments, and my mom's been able to bring me to work and home, and so shout out to my parents for being my chauffeur, because I wouldn't be able to do any of that. So I can't drive. I can't really walk upstairs totally correctly yet. When I put all my pressure and push down on my right leg, that's when I'm having the most issues with my knee. That's when like my kneecap is slipping out of place still, which is just so bizarre. All of the swelling is gone now finally, which is great, and some days are worse than others. Sometimes the physical therapy is a little bit more intense than I would like it to be, and then like the whole next day or the rest of that day I'm left pretty miserable and in pain. But I can tell that it is working. It's definitely helped improve my situation since I was injured. At physical therapy, they have been using an electrical stimulator on my leg to get me to engage my leg muscles. Because I was on the crutches and my leg was straight for so long, I lost all of my strength in my leg, and when I'm like laying on a bed, just to lift my leg straight up off of the bed was impossible. I couldn't lift it at all off of the bed, so that was a huge problem. I couldn't engage my muscles, so we're using an electrical stimulator at physical therapy, and I hate it. I had that when I was younger. I actually owned one when I was younger for my knee, and it's terrible, but it's definitely helping. One of the days it was on way too strong and I felt like I was being stabbed with 1,000 knives. I had to take off from work that day and just stay at home and sleep. My entire body was exhausted after using that. That was just too much, but I talked to my physical therapist after that and he like toned it down after that. But I can definitely tell that it's helping. I'm able to do a 4-inch step now. I could only do a 2. I couldn't do anything, and we started off with a 2-inch, now we're at 4. By the time I can do a regular step, I'll be ready for surgery and then I won't be able to do anything. So this is irritating because I'm working so hard and my body is so exhausted from going to therapy and from dealing with all of this for the past 5 weeks that I'm gonna be so irritated after I get the surgery and I'm starting over from square one basically. So I'm trying to get mentally prepared for the surgery. I'm ready for it to just be over. I have a lot of anxiety about doctors and about having surgery and dealing with needles. That's definitely still the thing that I'm the most scared about, is being put under general anesthesia, but I'm ready for it to be over. I'm ready to be in the recovery stage. I'm just ready. I have 2 more physical therapy appointments Christmas week, the days after Christmas I'm going, and then my surgery is on New Year's Eve in the morning, I guess, and hopefully they don't keep me overnight, but if they did, I mean, that would definitely be a New Year's Eve I would never forget. I'm very interested to see how this goes, and I'm interested to see how I react mentally to this whole thing, because I'm gonna have to have it done again to my left knee at some point in the near future after my right knee recovery is done. I'm very nervous that it's going to be terrible and I'm going to be just in so much pain and then I'm not going to want to put myself through it again, but I have to. They're the same. There's something wrong, probably even worse wrong with my left knee. I'm just, I guess, mentally preparing. I don't know. Let me know in the comments down below if you've ever had any surgery, if you've ever been under general anesthesia. That's definitely the thing that I'm the most nervous about. So let me know if you have any tips on general anesthesia. This has been a very crazy time because I'm preparing for knee surgery. I'm in the process of transitioning into a new position at one of my jobs. I've been going to physical therapy, which is taking a lot of my time, and then also Christmas is happening. It's just been really busy, and somehow in the middle of all of that, I decided that I also need a new bed. Behind me is my twin-size, child-size bed, and I've never had a problem with it. I've always really liked having a lot of space in my room, but I decided I needed to get a bed, a queen-size bed. All of a sudden, I've been thinking about the things that I'm gonna need for after the surgery, like ice packs and larger pants to be able to fit my swollen knee under, and all of a sudden I just decided, oh, I need a bed. And then I ordered one online on Amazon like that day. So that was crazy. I'm the type of person that has to think about a large purchase like that for a really long time. But that was an impulse buy. But I think that I'm going to be more comfortable having a larger bed because I am going to be spending quite a bit of time in it after the surgery. And I want to be comfortable. This bed is not that comfortable. I have been given quite a few surgery related gifts, which I'm very excited about. I've got some crossword puzzles and coloring books, which I'm super pumped on. I like stopping myself from starting doing those things before the surgery. And I have regular puzzles to do. I'm a puzzle person, and Chris is a huge board game person, so he's going to be bringing some board games over here after my surgery so we can play some of those. And I don't know what the weekend vlogs are going to be looking like after the surgery because I'm not going to be able to do anything at all right away. Luckily, we've been able to still do the winter things that we've had planned to do, that we do every winter. Go to the Couser Mansion for their Christmas tour and then go to Pensbury Manor for the Holly Nights. So I don't really know what's going to happen in January because I'm not really going to be able to do anything for a while. Hopefully I will be able to drive soon after the surgery. They had told me that I'm going to be on crutches for 6 weeks after. I'm feeling like I'm not going to be able to drive until like the end of February or March, and I'm already going crazy. And then also we have a Disney trip planned for March. I think we mentioned that in our fall favorites that we are going to Disney the middle of March, and I should be okay by that point to be able to walk, but a lot of people just keep saying to me, you know what, the worst thing that could happen is that you're going to be in a wheelchair and you'll get to skip the lines. We just might have to take it slow. I'm a very fast walker and it's been hard to remember that I can't walk quickly. I still can't do all of the things that I could do. I can't like get on my knees and I can't run upstairs, and I guess I'm experiencing this now, so maybe I'm a little bit more used to it after the surgery. I don't know. I'm just ready. I'm physically and mentally exhausted and I'm ready for the surgery. So let me know down below if you've ever been put under general anesthesia and what your experience was like. And thank you for watching. Make sure to leave that comment, like and subscribe, and follow me on Twitter and Instagram. I'll put those links down below.